Welcome to the Dr. Mudgil podcast. This is episode 164. We are now solidly into the new year. And this is actually a podcast that I wanted to record at the end of last year, to be honest with you. You know, when everyone was really talking about United Healthcare and all like, just healthcare stuff and how, insurance companies are basically screwing patients and their doctors and are this horrible middleman. And there was an op-ed article written by Andrew Whitty, who is the CEO, like the CEO of United Health Group. And it was at the end of the year, and I didn't want to end the year on like a negative note, just, talking shit about insurance companies and just how horrible and vile companies like United Healthcare are. I wanted to end the year on a positive note. I also wanted to start this year on a positive note. So I'm kind of saving this article to share with you guys. And it's an article, these are his words, and this is what he wrote. And this is from, at this point, like almost a month ago. But there are some things that I think are very important to discuss. I really do think it's important for patients and doctors to be as vocal as possible if we want things to change. Private health insurance companies are horrible, vile, disgusting institutions that really are impacting patients and their doctors horribly. There's literally no good that they do. If you think about it, I'm a patient also. So all of us, and I unfortunately have United Healthcare of Oxford, because I really don't have any choice. There's very limited choices in certain marketplaces and in certain, with certain businesses. And I hate them. They're horrible. But the way the way insurance companies work, the way any insurance works is, we all pay our premiums and that's pooled into a pot. So, like millions and millions and millions of us are paying our X amount of dollars a month. In my case, it's nearly $4,000 a month for my family of 5, and I have a deductible on top of that all. And the only way an insurance company makes money, literally the only way an insurance company makes money is sitting on that pot of gold. So the way they do that is they deny patients benefits if someone needs like an MRI or some kind of specialized test or whatever the case may be. They want to say no because that's going to cost them a lot of money. And, the way it works as doctors is we treat our patients and we submit our charges. And then we're basically just waiting for the insurance company to say, okay, we're going to pay you for what you did. Or, you know what, we're not going to pay you for these couple of things, but we'll pay you for this. Or we're not going to pay you at all. Or they'll pay us and then a year later say, oh, we need to audit you and you have to pay us all that money back. So the way they make money is by denying patients care and getting doctors to see patients for free, by basically effing us for payment for services we've already rendered because the patient's already been seen, already been treated, already been cured. It's a broken system. Insurance companies are the absolute culprit behind it. 100% nefarious institutions that literally want to fuck patients over and want to fuck doctors over so they can be as profitable as possible. Now, in that context, on December 13th, and this is when, this like pretty soon after the CEO of United was wrongly murdered in New York City. I mean, violence is never the answer, but this is an opinion guest essay written in the New York Times by Andrew Whitty, and the title of the article is United Health Group CEO, The Healthcare System is Flawed, Let's Fix It, December 13th, 2024, by Andrew Whitty. Mr. Whitty is the Chief Executive Officer of United Health Group, the parent company of United Healthcare. And here goes. As Brian Thompson's family, friends, and colleagues mourn his killing, we are bearing a grief and sadness we will carry for the rest of our lives. Grief for the family he leaves behind, and grief for a brilliant, kind man who is working to make healthcare better for everyone. We greatly appreciate the enormous outpouring of support for Brian, who ran our health insurance business, United Healthcare, as well as for our wider company, which I lead. Yet, we're also struggling to make sense of the unconscionable act and the vitriol that has been directed at our colleagues who have been barraged by threats. No employees, be they the people who answer customer calls or nurses who visit patients in their homes, should have to fear for their safety and loved one's safety. I agree with that 100%. The people of United Health Group are nurses, doctors, patient and client advocates, technologists, and more. They all come to work each day to provide critical health services for millions of Americans in need. We know the health system does not work as well as it should, and we understand people's frustrations with it. No one would design a system like the one we have, and no one did. It's a patchwork built over decades. Our mission is to help make it work better. We're willing to partner with anyone, as we always have, healthcare providers, employers, patients, pharmaceutical companies, governments, and others, to find ways to deliver high-quality care at lower costs. I take umbrage with that. I think there's a lot of bullshit in the paragraph, but I'll get to that at the end. Clearly, we are not there yet. We understand and share the desire to build a healthcare system that works better for everyone. That is the purpose of our organization. No, I think the purpose of your organization is to generate profits for your shareholders and to enrich yourself. But you can say what you wish. Healthcare is both intensely personal and very complicated. The reason behind coverage decisions are not well understood. We share some of the responsibility for that. Together with employers, governments, and others who pay for care, we need to improve how we explain what insurance covers and how decisions are made. Behind each decision lies a comprehensive and continually updated body of clinical evidence focused on achieving the best health outcomes and ensuring patient safety. Bullshit. Again, I call you bullshit. Really, your policies are designed to enhance your profit margin. And I 1,000% stand behind it, and I kindly would ask you to debate me about it. I'll be happy to talk to you. While the health system is not perfect, every corner of it is filled with people who try to do their best for those they serve. Brian was one of those people. He was raised in the same Iowa farmhouse as his mom. His dad spent more than 40 years unloading trucks at grain elevators. BT, as we know him, worked farm jobs as a kid and fished at a gravel pit with his brother. He never forgot where he came from because it was the needs of people who live in places like Jewell, Iowa, that he considered first in finding ways to improve care. When a colleague proposed a new idea to Brian, he would always ask, "Would you want this for your own family? If not, end of discussion." Brian was never content with the status quo. That's why he pushed to build dedicated teams to help the sickest people navigate the health system. It's why he fought for preventive health and quality health outcomes rather than simply adding ever more tests and procedures. He believed decisions about healthcare should start with the individual and championed plans in which consumers could see costs and coverage options up front so they could decide what's best for themselves and their families. The ideas he advocated were aimed at making healthcare more affordable, more transparent, more intuitive, more compassionate, and more human. That's Brian's legacy, one that will carry forward by continuing our work to make the health system work better for everyone. Well, that's the article. Now, I will say that Andrew Whitty, I think he made like $23.5 million or something like that in 2023. I don't know if the 2024 numbers are out yet. There are two CEOs who made around the $16 million range. So just between them, that's over $50 million. And then there are a bunch of executives like Brian Thompson who made like the $10 million range. So you're already looking at like $80 to $90 million most likely. And it's probably much more than that, to be honest with you, of executive compensation at United Healthcare. Now, if you're trying to make healthcare more affordable, more accessible, and all the sort of token bullshit terms that you use, why not just start by cutting the reimbursements of the folks at the top? Again, the only way healthcare companies make money, healthcare insurance companies, I should say, is by denying benefits and denying reimbursements to doctors. It's literally that simple. The reason why you say it gets so complex and you have all of these different technologists and whatever the other folks that you mentioned is because you want to make it confusing. Health insurance companies want to make it as difficult to navigate the health insurance quagmire as possible because, when a patient is denied benefits, so say, a patient needs some kind of prior authorization or something from the doctor, we're slammed with this stuff and we're slammed with patient care. So we always deny and appeal decisions by insurance companies because that's just what we do. But a lot of doctor's offices cannot do that. They don't have the resources to allocate for that. So health insurance companies know that if they deny something or require some notes or whatever they may require, that half the time that's just not going to be sent in. And then of those that are sent in, those are going to get denied again. And of those, probably only 1 or 2% will file another appeal. The system is designed to screw patients and their doctors over. It's literally inherent to the system. And folks like Andrew Whitty are the ones who design these nefarious, traps and, mazes for patients and their doctors to navigate. I mean, listen, you're the boss, right? You are the one that's doing this. Now, I have a very simple solution for this. Why not let patients like myself, why not let us buy Medicare? Medicare has like a couple of percent, operating costs, and everything else, the dollars that go in are used to take care of patients. It's a very simple system. They're not, all of these sort of crafty ways to screw patients over and crafty ways to screw the doctors that care for them over. As I've said before, there's no pure relationship in the patient-doctor relationship. Patients come to doctors because they need help. Doctors literally go to over a decade of grueling schooling and training to care for their patients. It's a calling, it's a passion that we have. And who gets in the middle of it all and fucks it all up are private health insurers like United Healthcare that are trying to exploit patients and exploit their doctors to maximize their profit margin so they can pay Andrew Whitty his $20+ million in salary every year, and all of those other executives who are making tens of millions of dollars as well. If we were allowed to buy Medicare, it may keep private health insurers honest, because who in their right mind would buy a shitty health plan from a private health insurer when they could buy Medicare, which is, most doctors will tell you, they're the easiest to deal with because they're honest. That's what we all need to do. But it's never been done because our legislated officials are in bed with these slimy companies who are paying for their campaigns and all that other bullshit. And who gets screwed? The folks that, us, private citizens, who are electing these folks into office. So it's up to us. It's up to patients. It's up to their doctors to be as vocal as possible. It's literally not that complicated. Private health insurers are profitable because they're screwing patients and their doctors. That's the only way they can be profitable. Just get rid of them and let us buy Medicare, and I can guarantee you our society will be much healthier and we'll be much happier with healthcare in this country. So something to think about, something to talk to your elected officials about, something for us all to talk about, patients and doctors alike. I hope you have a wonderful, restful weekend. Or just ready to crush the week ahead. Let's get it.